Testosterone.
Yes.
This is an interesting one, okay? The male testosterone, let's call it testosterone or recipienate or something, and the female testosterone. If you took the testosterone out of the woman and out of the man and you looked at it, it's exactly the same thing, isn't it? It is, eh?
Spot on.
But here's the thing. I have a 2-liter jug full of testosterone. You have a teaspoon. Am I correct?
You're right.
Okay, so now I've got to ask. So when the female testosterone drops to a drop of testosterone instead of that sort of tablespoon amount that she has,
Yes.
what effect does that then have on her?
Absolutely. It's wonderful because as a woman, as you rightly say, we've got all 3 hormones, estrogen, progesterone, testosterone, in different concentrations to our men, right? And testosterone is a real feel-good hormone. It's the vitality hormone. So you feel strong, you're building muscle, you're losing fat. And again, it's got huge mood impact. And so we almost go through a menopause. We're putting the men in menopause,
Yeah.
right?
Okay, good.
And so part of it is a cognitive thing, but from a health point of view, it has huge benefits in terms of preventing heart attacks, strokes. It helps our bone density. And so in that way, as much as we appreciate make sure we don't virilize or grow male hair or get the really strong muscles, there's also health benefits to maintaining and making sure that our testosterone levels are really good.
Do you know what I read in that little thing that you just said now?
Yes.
Was the mood, because mood is associated with depression and anxiety, am I right?
Hundreds.
So, if I put that one and one together, can we then say that if the testosterone levels in the woman is too low and is linked to mood, can that then be depression? And then is it possible that sometimes women are treated with, what are those tablets for depression?
Kind of anti-anxieties, antidepressants?
Antidepressants, so they get an antidepressant instead of getting a bit of testosterone. So the patient gets antidepressants instead of a bit of testosterone. If they got a bit of testosterone, that would be cool.
Absolutely.
But now they're getting the tablets for antidepressant, but that then has side effects of no sex drive and this and that, and they can never get off it, etc. Is that what you're saying?
Correct, and this is what makes the body so amazing, is that everything links into each other. And when you look at diagnosing someone with a psychiatric illness, it would be remiss as a doctor if we didn't look at blood panels.
Wow.
Right. So anxiety, depression, fatigue, a lot of those kind of symptoms that mimic anxiety, depression can be attributed to other things. An underactive thyroid, a low iron level, hormonal imbalance. And those are just some of the few. So it is very important, as you rightly say, to look at those kind of things before we start prescribing things off the bat for patients.
Yeah. No, that's interesting. I mean, I want to get into that subject. I must definitely come and see Dr. Brink again, because for me, I want to look even deeper later, like when a woman has had 1 or 2 kids.
Yes.
Okay, her hormones have done this. Now, after she's had the kids, has her testosterone levels dropped, has her estrogen dropped, and now she's got depression, and the next doctor goes, or the next person goes, take some anti-anxiety and some antidepressants, where all she needed was a bit of estrogen and testosterone, and now she's great. So I wonder, doctor, how many people are walking around there on these tablets, and they should be on this, they don't need it, they needed a bit of testosterone, and suddenly they're cool.
That's it.
Imagine, eh?
Oh man, you're so right.
Doctor, the testosterone that you're speaking about, be it estrogen, testosterone, whatever, this is what's prescribed by a physician, whether it's a specialist physician, a doctor such as yourself.
Correct.
Not prescribed by the personal trainer in the club, am I right?
Correct. Okay. I think true of any hormone, it's important to make sure it's within normal limits, because in excess, it does have negative effects. It has terrible things on making your blood quite thick. We know the story when it shrinks testicles and it affects fertility. It also has huge impact on cholesterol.
And I don't think sometimes people realize the chain reaction.
Absolutely right.